Welcome back to our discussion here on Flashpoint. Let's get to health care. Congresswoman Miller, are you going back to Washington with the intent of repealing what we've come to know as Obamacare, or do you just want to see it changed and some of it stay intact?
I'm going to vote to repeal it. I think the Republicans will bring a vote on that very early on. I think that's very important. One of the biggest problems, not only the cost, talking about this deficit with now it looks like about $1 trillion of cost for Obamacare, is I think the constitutionality of it, which is being challenged by a number of states, including our own.
Including Michigan,
and
yes.
I would just mention one thing. I'm very pleased that I'm on the transition team. Speaker Luck Boehner has put me on there, and that's one of the things that we want to do is change the rules of the House so when you introduce a piece of legislation, you actually have to attach to it a congressional cite. So you're citing the statute, the part in the Constitution to make sure that these bills are constitutional.
Congressman McCotter, you're same thing on just repealing the health care, or do you think there's anything in there worth saving?
Well, you have to repeal and improve it. You have to, as a practical matter, we know that's not going to happen. We'll vote to do it. It won't happen. We have a president who's been elected for 4 years. We have a Senate, which is still in Democratic control, at least a majority. So the question will become, can you find after you vote to repeal and honor that promise, can you then go through and find ways that you can make it more patient-centered, that you can find ways to reduce its impact upon individuals? Can we find a principled basis where we go forward to shape a piece of legislation that actually, I would argue, augurs well for the United States in a 21st century economy rather than going back to LBJ's Great Society, which, as our last discussion showed us, with entitlement spending and everything else, may no longer be the most optimal model for the 21st century of a globalized economy.
Congressman Peters, you voted for the health care package. Is it dead?
No, it's not dead, and I hope that we don't have just Republicans just voting to repeal and then not coming back and saying, let's figure out how to make this better. Back to my comments that I made earlier in the show. Hopefully that we can look at what we have in common. Hopefully in common we want to be able to provide affordable health care for all Americans. That's got to be our goal to do that. And there's some very good things in this health care package. There's some great reforms in there, particularly protecting patients from insurance company abuses to make sure that you won't be denied if you have a pre-existing condition, the ability to keep children on until age 26 to their parents' policy, and that's a big deal for folks, to be able to have that kind of security for their children. To repeal that is wrong. To let the insurance companies come back and control health care for us is not the good solution. And instead of doing that, we need to be thinking about how do we make it more cost-effective, provide quality care for all Americans.
Hansen, Clarke, jump in. Your thoughts?
I support health care reform, but the implementation of that act is going to be very important. So I'm going to make sure that people have access to health care here in Metro Detroit. That means clinics, primary care physicians, nurse practitioners. But really, the underlying issue, though, in order to have a healthy population, it's not just having insurance. We've got to reduce this environmental pollution that's causing people to be sick. We've got to improve their lifestyle and their diet. We have to have fresh fruits and vegetables available here.
Pollution may get us into cap and trade, which I know you won't get any agreement with on the other side.
And if I could just mention one thing just about the cost, when we talked about taxes, the most unfair tax there is for Metro Detroiters is the high cost of insuring their home, automobile, and business.
Redlining, no doubt.
Exactly. So I'm going to look at maybe doing some changes there with the antitrust protections that the insurance companies have.
I hate to go back to this and keep beating this drum, but it feels to me that President Obama did get elected telling everyone there was going to be health care reform, and the kind of things that Congressman Peters just pointed out, not being denied coverage, not being thrown off coverage, pre-existing conditions, the 26 years old for, especially with a lot of kids coming out of college with no job to wait for them. Aren't there some things worth saving?
Well, you know, I think, as is mentioned here, obviously we're going to vote to repeal it, and if we can't have enough votes to override a presidential veto, which is highly unlikely, then I think we will look to defund various parts of it. And there are a lot of parts where I think we may even have some agreement about defunding various sections of it. But, you know, I will say this. I don't think there was anyone who didn't think that we needed to have some health care reform. But I certainly think now with, as I say, the cost over $1 trillion, I think having market-based reforms is very important. Having the ability to purchase insurance across state lines, which would drive up competition and drive down costs. There are a number of things hopefully we can agree on to move forward.
Go ahead, Congressman.
Well, and I think that the market is in there. It is very market-driven. The insurance exchange that is created will have private insurance companies competing very aggressively for business, which is a market-based system. And it could be across states. You could have groups of states together. If I would have had my preference, it would have been across the country. But we are going to have multi-state exchanges with private insurance companies competing, which is a market-based solution to a problem.
Got about 15 seconds, Congressman McCotter.
The public's spoken. They had Republicans elected on the basis that they did their own determination. They didn't like the health care bill. they'd rather see us find solutions that make sense to them.
Gang, thank you all very, very much for being here. I know you're all headed to Washington here in the next today or tomorrow. Thank you so much for making time with us, and thank you for making time as well. Meet the Press is next. Have a great week, and we'll see you next time on Flashpoint.